Babies are dying in the Black community. Did you know? What we will talk about today is what infant mortality is, why are our babies dying, what we can do about it, what's going on in our community currently to save our babies, and what ways can you get involved. Did you know that in Cuyahoga County, Black women are more than 3 times as likely to have their child die before their first birthday than white women? This means that for every 1 white baby that does not celebrate his or her first birthday, 3 Black babies will not celebrate theirs. We're talking about infant mortality. Infant mortality is measured by the number of babies that don't make their first birthday per 1,000 live births. So for every 1,000 babies born, the number that does not survive makes up the rate. And in Cuyahoga County, the 2008-2010 rate for Black infant deaths was 15.5, and the rate for white infant deaths was 5.3. This illustrates the racial disparity in infant mortality in our county. When a baby does not reach his or her first birthday, we want to know why. The top 3 factors in Cuyahoga County that contribute to a baby dying before their first birthday are listed here. The first and number 1 factor is premature births. That's any baby that is born before 37 weeks gestation. The second leading factor is a baby born with a birth defect. And the third is sudden unexplained infant death syndrome, sudden infant death, or babies dying while sleeping. The 2 factors that have the greatest opportunities for prevention are premature births and sleep-related deaths. Research has shown that babies that are born too early and too small are less likely to survive. Even though there are medical reasons that cause premature births, there are some actions that can be taken to reduce the risk. Behaviors such as smoking, poor nutrition, having untreated infections, or not managing chronic health problems can all impact your ability to carry your baby to full term. Stress also impacts preterm birth. Another risk factor is having a shortened cervix. This can be diagnosed by your physician and treatments are available. The best opportunity to carry a baby to full term is to be healthy before you become pregnant. One of the most preventable causes of a baby dying is practicing the ABCs of safe sleep, alone, on the back, in a bare naked crib. Every year, babies die because they were sleeping with someone, or sleeping on a couch, or sleeping with pillows and blankets and stuffed animals, or placed on their stomach to sleep. Every year in our county, in our communities, babies die because someone did not practice safe sleep. It is never a person's intention to put their baby to sleep and they never wake up, but it happens. In 2012, 18 babies in our community died while sleeping. 13 of those babies died while sharing a bed with someone. 12 of those 18 babies died in the city of Cleveland. Between 2005 and 2012, 104 babies in Cleveland died while sleeping. 163 babies died in the entire county. If you need more information about safe sleep or resources, we can share them with you at the end of this presentation. So what do we know? We know that prenatal care is important. We know that a healthy diet is important. We know that babies should sleep alone on their back in a bare naked crib. We know that if you're not ready to become pregnant, that it's important to use birth control and condoms when having sex. We know that you shouldn't smoke or use drugs and drink alcohol. We know you should avoid unprescribed medication. We know that if you're not ready to become pregnant, it's important that you plan your pregnancy to increase the best opportunity to have a healthy baby. Because we know what's important to help mom have a healthy baby, there are a number of programs and services available to guide mom before, during, and after her pregnancy. We have neighborhood clinics and hospitals throughout the county. Access is available to all. There are home visiting programs for moms and families, programs that address nutrition like WIC. We have case management, housing assistance, financial assistance programs. Cuyahoga County has a number of resources to support mom and her family. Despite the availability of clinical and social services in Cuyahoga County, our babies are still dying. We need to talk about infant mortality because what we're doing is not enough. And the truth is, people do not know. If you asked your neighbor if they knew that black babies are dying at 3 times the rate of white babies right here in our neighborhood, what do you think that they would say? If more people knew, more people can get involved to make a change and save the lives of our babies. We need to get to the root cause of why our babies are dying. The root causes are sometimes referred to as the social determinants of health, which are the non-medical factors that we don't have a lot of control over. These factors impact us in ways that we don't even realize. Many of us do not have control over the condition of the neighborhood where we live, whether we have access to jobs or needed services. Many of us do not have control over how much our job pays us. We definitely do not have control over our race and the perception that others have of us based on the color of our skin. In many cases, we don't have much control over the quality of education. It all depends on where you live. In Cuyahoga County, like most counties, place matters. Where you live impacts your health and can impact your pregnancy. If you live in a community that does not have grocery stores that sell affordable foods, what do you feed your family? If you live in a community that has vacant lots, where do you send your children to play? If you live in a community that does not provide quality education, what does that say for the future of your children? Do you think it's fair that one community can have opportunities for quality education, quality food, safe places to play, while another community does not? Did you know that there are some neighborhoods in Cuyahoga County that are more likely to have a baby die than others? As you can see on this map, the areas in red have the highest infant mortality rates. Most of the red areas are located on the east side of Cleveland and in the first ring east suburbs. Coincidentally, these neighborhoods have mostly African American residents. Do you live in any of these neighborhoods? How does that make you feel? If you don't live in any of these neighborhoods, how does that make you feel? Here is a closer look at the City of Cleveland infant mortality rates for 2011 and 2012. The neighborhoods highlighted in red have the highest infant mortality rates. Do you think it's fair that a baby born in Kinsman or Lisaville has less of an opportunity to reach their first birthday than a baby born in North Shore, Collinwood, or Ohio City? Though the root causes are difficult to address as an individual, there are some things that are in your control that can increase your opportunity to have a healthy baby. These are things like going to the doctor, getting regular checkups and prenatal care, planning your pregnancy, being active, eating healthy. Another way to impact infant mortality is to talk about it, because people don't know. We want you to get involved. We want you to talk to your friends, talk to your family, your coworkers, talk to your churches, talk to your community about infant mortality. Black babies are dying at 3 times the rate of white babies. Why? What is going on? With multiple hospitals and clinics, with wonderful social services and home visiting programs, babies are still dying. We need you to get involved. One way to get involved is to join the Cleveland-Cuyahoga Partnership to Improve Birth Outcomes. This is a group of people from different agencies and organizations and communities throughout the county that acknowledge that things need to change and we need to make a difference. We want you to become involved in saving the lives of our babies. The Cleveland-Cuyahoga Partnership to Improve Birth Outcome has selected 2 strategies to help save our babies. The first strategy is related to prenatal care, focusing on a program called Centering Pregnancy. The second strategy is family planning, planning your pregnancy, thinking about your future goals and how having a baby will impact your ability to achieve those goals. Did you know that there is more than one way to receive prenatal care once you're pregnant? The traditional way is to make an appointment and see your doctor or midwife one-on-one through the duration of your pregnancy. But the other way to receive prenatal care is through a program called Centering Pregnancy. Centering Pregnancy is group care that does more than just provide checkups. It provides support and education about all types of issues and concerns related to the pregnancy and parenting. You can attend with 8 to 12 other women that are in the same month of their pregnancy. You get a chance to go through it together, share stories, and make friends if you want. The Cleveland-Cuyahoga Partnership to Improve Birth Outcomes is working to increase capacity of centering pregnancy in our county, to offer it to more women, and to raise awareness. Centering pregnancy has been proven to have lower numbers of preterm babies and fewer low birth weight babies born in their program. Did you know that prenatal care isn't the only factor that will affect your pregnancy and the health of your baby? Did you know that over half of all pregnancies are not planned? If you are not planning on becoming pregnant, it's important to use birth control or condoms or abstain from sex totally. Though it's important that we plan our pregnancy at any age, it is especially important for our young people so we can ensure that they have the greatest opportunity to graduate from high school. Pregnancy can also make it more difficult for our young women and the father to complete their high school diploma. The Cleveland-Cuyahoga Partnership to Improve Birth Outcomes is planning to work with area school districts to ensure that each young person has access to a plan for their future, and always consider how a pregnancy may impact their ability to meet their goals. So what's next? What are you going to do after today? We need you to tell somebody about infant mortality. Talk to people and let them know that babies are dying in our community. Black babies are dying at 3 times the rate of white babies, and we need to do something about it. Become an ambassador and share this information. Talk about safe sleep with your family, your friends, your churches. Talk about family planning. Let people know that there's new ways to receive prenatal care and get support during your pregnancy. Join the Cleveland-Cuyahoga Partnership to Improve Birth Outcomes to discuss these and additional strategies to improve infant mortality in Cuyahoga County. Here are some of the organizations that are working with us to save our babies. We have foundations, hospitals, clinics, social service agencies, home visiting programs, managed care providers, and we need you too. We need you to get involved with the Cleveland-Cuyahoga Partnership to Improve Birth Outcomes. Our team meets on the 3rd Thursday of every month at 2 o'clock at the Friendly Inn Settlement House, located at 2386 Unwin Road in Cleveland, Ohio. If you would like more information about the Cleveland-Cuyahoga Partnership to Improve Birth Outcomes, our strategies, infant mortality, or different ways that you can get involved, please contact Angela Newman-White at 216-201-2001 extension 1517, or Lisa Matthews at 216-664-4281.